welcome to Library Connection. I'm your hostess, Mandy Cantrell. Many times on our show, we have people in the community that are maybe promoting certain events, or we're promoting events from the library, but a lot of times we have just someone in the community that is a friend of ours that we would like for you to get to know, and that's what we've done today. My dentist is joining us today, Dr. Chris Salman. Thank you for being here with us.
Thanks for having me.
Right. I just wanted you to come on and tell people a lot of things that are going on with your office and things like that. I know we were talking before the break about some really neat things going on, but first tell us about yourself and your family. Okay,
well, I grew up in West Virginia, and I went to college in Mobile, Alabama. That's what brought me to Alabama initially, was a soccer scholarship.
Oh.
And I got a degree in chemistry and mathematics from University of South Alabama, and I worked as a chemist, and I actually taught for 3 years and coached soccer. I've done a bunch of different things.
Oh, I didn't know all that.
Yeah, I did a lot of different things before I went back to dental school. But that's what brought me to this area. Was I came to University of Alabama at Birmingham, of course.
Right.
And went to dental school and got a job after I graduated from dental school, kind of in the area. And around that same time, I met Dr. Mims, and he was looking to retire, and so it really worked out well. And I've enjoyed being here in Sylacauga now for about going on 8 years.
8 years, is that right? So what made you change from wanting to teach or be a chemist to dental school?
It just naturally evolved from one thing to another. I was always looking to challenge myself and do new things. I enjoyed my dentist in Mobile. I thought he was a great guy. I learned a lot from talking with him, and that initially sparked an interest in me. Realizing also that the entrance exam for dental school was kind of heavily weighted in chemistry. It was a plus.
Right.
And there's an artistic element to dentistry I preferred over general medicine.
Oh, okay.
That I get to do every day, you know.
So. That's great. Well, you've come a roundabout way to dentistry. That's great. Now tell us about your family. I know you have several children.
Yeah, I've got 5 kids. I got a really wonderful wife. If she was here with me right now, I'd have her sitting right here to say hello to you. But we have a blessed life. My children are all healthy and doing well in school, and behave relatively well. And
well, they're regular children, I'm sure.
Yeah.
Well, great. And are they involved in a lot of different activities, or does anybody play soccer, since you're a soccer player?
Yeah, I have one son, and the rest are girls. And I've not pushed him towards it, but he likes soccer naturally, and he's doing well with that. They're all big swimmers. We do the swim team thing, and that's their big thing, swimming. And
that's great.
Yeah.
And school.
In school. Lots of homework.
Oh, yes. Well, yes, you and your wife have your hands full, I'm sure, with that many children with lots of homework.
Yeah, lots of homework.
Yeah, but we are really glad you're here in almost 8 years. We were talking about things you're doing, but first of all, now I want to see, where is your office? That's what I want to make sure we tell people where your office is.
Sure. My office is on 495 West 3rd Street, just where other dental offices are, 3 in a row there, and then the eye doctor, Dr. Cantley, who bought Dr. Kahn's office, is right adjacent to me, across from the funeral home there. I'm sure most people know that's kind of the spot where people know the dentists are hanging out.
It's the dentist corner there, or the area. That's right. And your staff, you have a wonderful staff. I must say, I enjoy every time I go in there for a checkup or cleaning, and you're wonderful. The girls are so nice. We have a great time.
Yeah, I feel very fortunate. My staff, I think most days, if you come in my office, you'll hear them talking loudly, giggling, having a good time at work, probably more than they should. But there's ups and downs. Of course, there's days where we have lots of emergencies, walking in the door, and someone in the school's called and someone's kid is sick and they're having to leave early, and we have to hustle. And there's times like that, but mostly those girls are very happy and having a good time and enjoying. They know everybody that comes in the office typically, and I have a great staff. They're very, very good at what they do.
I always feel right at home when I come, and I've been going there for years, but they see me twice a year, but they're always just very friendly and so nice. I appreciate all that. And now, what kind of services do you offer? But I know the cleaning and checkups and all that.
Yeah, that's another thing I like about dentistry, general dentistry, is that we can dabble in whatever we choose and do as much as we want, and so I don't get bored that way. I pretty much do everything that you can think of, except braces. I'm not too interested in. I refer all that to the orthodontist. But I take out most of my own wisdom teeth, unless they're really difficult. Then I'll send somebody to an oral surgeon. Everything you can think of, though, fillings, of course, root canals, extractions, implants, dentures, partials, just about anything you can think of that a dentist does, I'll do it. Did I answer your question?
Yes, I think it does. Really, I know there are a lot of other things that you do. Not a lot of other things, but we were talking specifically about laser dentistry.
Mm-hmm. Yeah.
You were telling me a lot about that, which was something I didn't know about.
Yeah. I bought my first laser about 5 years ago. It's an expensive endeavor. That's why you don't see as many people probably getting into it. And there's a steep learning curve to it. You finish dental school and you have a certain skill set that you're very comfortable with, and to jump to laser stuff, it's a whole different arena. And so it took me probably 3 years to really get comfortable with a lot of it. And I've now bought a second laser because I was steering patients from one room towards another a lot because I wanted to use the laser for something. Now I've got one in both my main operatories. The second one I bought is really nice. Very expensive again, but sure. I can do so many wonderful things. I was telling you, for an example, lingual frenectomies, where kids are tongue-tied. I think a lot of people understand what that is. You tell a kid that they'll develop a speech impediment a lot of times, but you tell them to stick their tongue out, and they can't stick their tongue out because it's attached so tightly to the floor of their mouth. Traditional approach would be take that child, send them to an ENT, have them put to sleep with anesthesia, take a scalpel, get rid of that thing. But with the laser, I don't even give a shot. I just rub a topical anesthetic on there, and in a few seconds I can take that laser and get rid of that thing, and it hardly bleeds, if it bleeds at all. And which you don't get with a knife, That's true. And it heals so much faster and there's less pain. So that's one example of many things that I can do with the laser.
That is great, and I know we don't think about being put to sleep, but it is difficult on your body. And I know you said especially for children.
Yeah, with children it's a greater risk of course, anesthesiologists know what they're doing, but if I can avoid putting my child to sleep, I'd rather, not.
It's not something you want to do unless you have to. Mm-hmm. So if there's a way to not do it, that's great. And you were talking about, is it fillings?
Mm-hmm. with yeah, that's another thing I use my laser for almost on every filling.
Okay.
Even if I have to numb the tooth up and take out an old filling, like a silver filling, before I put in a new filling, I take my laser and I paint over the surface of the tooth, and it just essentially sterilizes the surface of the tooth and doesn't leave any bacteria behind. And it makes the surface of the tooth such that the filling sticks better to the tooth than it would have, So there's certain areas on teeth that we have trouble with sometimes where the filling wants to pop out because of the forces put on the tooth and the way the tooth can flex. But I don't have that problem with the laser. It makes the filling stick to the tooth better, and it does. And that's just one of the many examples that the laser helps me.
So it's not just for specialty type of procedures.
It's for all the everyday things, pretty much. But there's certainly a lot of specialty things that I just got a license to do a cosmetic procedure with it, and I'm pretty sure I'm the only person in the state licensed to do that at this point. And one of the things that we do with that is we treat sleep apnea and snoring. Okay. Because by and large, 9 times out of 10, that problem is airway constriction, in the back of the throat, and we take the tonsillar areas and the soft palate, the uvula that dangles down there, and we can use the laser to shrink all that stuff and produce collagen and tighten all those tissues and open the airway. And with management like that, you can reduce or eliminate snoring, and sometimes the even moderate to severe sleep apnea is greatly improved. So.
Oh, that's great.
Yeah.
I didn't realize. I guess I never thought about dentistry and sleep apnea.
In fact, dentists really, for a long time, have been probably one of the most utilized professions for that. Yeah, because we make mouthpieces and stuff that position the airway better. And sometimes what I've learned now is that if you use those mouthpieces and you do this laser therapy, the two combined is a great benefit.
Good. Wow. Well, if someone thought they might need this procedure, how did they? I mean, I know they call your office and make an appointment.
It's a simple screening. Just look in their mouth and kind of see. There's different classifications of airway constrictions, and so we can look at that and kind of predict how well it's going to work for some people. Some people are harder to treat than others because of their anatomy. Right. But I can take a quick look and tell right away if how much it's probably going to help them. Yeah.
Good, good. Well, I've learned something. I did not know that. I have to tell my husband, who snores a little too. He'll probably tell you
That's a common problem.
Well, that is interesting. So if somebody wants to know, they just can call your office. What's your phone number?
It's 256-249-2211.
Okay, I should know that. I just called not too long ago, but so they can just call and make an appointment. And are you open 5 days a week?
Well, we're definitely open 8 to 5 right now, Monday through Thursday, and we've mostly been working about 2 Fridays a month. All of that's kind of dependent, and so, but those are pretty much the hours. But all someone has to do is make an appointment, and we'll be there,
Right.
But we're thinking about expanding hours in the future.
Okay, just wait and see what the need is, what the demand is.
There's just some issues with my building size and whatnot right now, but I'm working on that. I got plans.
Well, great. Good. Well, we're glad. Sounds like you're going to be here a while, we hope. That's
wonderful.
Good. Well, we're going to take a quick break for commercials and hope you'll join us after the break. We'll talk some more with Dr. Salmon.
In Central Alabama, 9,100 kids face going to bed hungry tonight. Hunger doesn't take a day off. There are kids right here, right now, that don't know where they'll get their next meal. Join Alabama Childhood Food Solutions and help put an end to childhood hunger in Central Alabama. Make a difference. Donate today, by mail or online, to help ACFS feed hungry kids. There's no better time to share than now. Their next meal could come from you.
Any meal, anytime, it's a Huddle House on Highway 280. From the popular Huddle House signature waffle to our Big House breakfast, including gravy and biscuit and loaded hash browns, it's a Huddle House. Try our Philly cheese steak omelet. It's a sure hit, too. Our Big House sandwich combos include Huddle burger and country fried steak. And for lunch or dinner, it's the often requested chopped steak with mushroom gravy. Starting to get hungry? Head to the Huddle House. Our friendly and experienced team await you. Huddle House, Highway 280, any meal, anytime.
At Marble City Pharmacy, we're more than just a drugstore. Our gift shop boasts some of the most unique treasures you'll find anywhere. Come in and browse the vast selection of jewelry, purses, clothing accessories, and crafts. Let our friendly staff help you find that special card or gift for any occasion. Our dollar wall features selected sale items, and we stock a wide variety of specialty items. And if it is a drugstore you need, Marble City Pharmacy was named the 2015 McKesson National Pharmacy of the Year. Visit us today at Marble City Pharmacy.
Since 1935, the Collins family has been the automobile business in Sylacauga. Bobby and Anderson Collins carry on that tradition today at Stop and Shop Auto Sales. Select from late model cars, trucks, and SUVs. And our vehicles do not go on the lot until they are thoroughly inspected by our experienced mechanics. At Stop and Shop Auto Sales, we offer a 30-day warranty on all our inventory. Family owned and operated for 4 generations. Stop and Shop Auto Sales, 230 West 1st Street in Sylacauga.
Hello and welcome back to Library Connection. I'm Mandy Cantrell. I'm talking with my dentist, Dr. Chris Salman from here in town. We're getting to know a little bit more about him and about his practice. He's been here for 8 years, about 8 years. We were talking about the different services he provides. And one thing that I thought about, how's dentistry changed since you have become a dentist?
I would say it just continues, like most things, to get better and more technologically advanced. The drugs, the techniques, the materials have gotten all better. When I first started, the standard crown was a porcelain fused to metal crown, but now those materials they've developed with zirconium have gotten so much better that pretty much we don't have to use metal at all now in dentistry. And that's just one example I can think of.
Oh, yeah. Well, if you'd been in practice for 25 years, I think you'd have a lot of stories, but I'm glad to hear it. Even it still is progressing, I guess.
Yeah, it sure is.
That's great.
Implants are a big thing.
Yes, tell us about that. I'm not even sure I know exactly what that is.
Yeah, so 2 basic ways we use implants are to say if you've lost a tooth, you got, you had some bad luck and you had to lose a tooth and it was critical to you, you wanted that tooth back. The best option is to place an implant immediately if you can, where we put a titanium, it's like a little screw, back down into the spot where the tooth root was, let that heal. And then once that heals, it's titanium. It's just like a knee replacement or a hip replacement. Okay. The bone likes it and fuses to it. And once it's there, it's permanent, and then we can put a crown, attach that. And it's just like you have a tooth again. And I tell people it's even better because you can't get a toothache on it. You'll never get a cavity on it.
Oh, that's true.
And titanium doesn't rust. So.
Oh, that's great. That is good.
That's probably our favorite way to use implants. Another main way, that's why I brought this, is for someone who has no teeth and they're wearing a denture, especially on the bottom. The bottom denture, if you talk to people enough, you'll realize is the hardest thing to wear. Okay. That's the jaw that moves around and has lots of muscles attaching to it from the tongue and the cheeks. And so a denture on the lower especially just kind of flops around in someone's mouth. But the bare minimum is to place 2 implants, and then we put attachments up in the denture, and then you can put that denture there and it snaps down, and now it doesn't move.
Oh, that's great.
And so you can eat a lot better, and you don't have to worry about this thing flopping out of your mouth,
Right.
We can do it on the upper as well, but it's a real benefit to someone who's trying to wear a lower denture. Right. And so this is a life-changing thing here for people. It really is. If they're having to wear a lower denture and you put in some implants, it really affects their life. Right.
How much time before you put the screws in till you can get your teeth? Or I know it has to have time to heal.
Typically, we place them and we put them under the skin, and then you wear your denture over it, just like you would as it heals. And so there's not a time where you have to go without teeth if that's your concern. Good. That's what you're asking.
That's what people I think worry about. Yeah, right. Yeah.
Yeah, we can always work around things like that where people don't have to go without teeth,
Right, because nobody wants to do that. Really. And I'll have to just jump in here and tell you saw my mom when she was in her 80s and was having trouble with her false teeth, and I always appreciated this because we could have bought her some more teeth, but because of what was going on with, I guess the bone was shrink. What am I trying to say?
It was changing,
and she was older, and it would, so I always thought that was really nice that you didn't try to sell me something that she wasn't going to benefit from. But I did appreciate you taking a look at her and tell me the truth. You could get them if you want to, but there's really not a benefit. And you were absolutely right. She made it fine.
Yeah.
She made it fine and ate soft food. That was no problem. So I thought that was very nice. I appreciate you doing that, not trying to make her, buy teeth if she didn't need them.
Yeah.
And another thing is you're one of our summer reading sponsors. I know I'm jumping to something else, but we appreciate that at the library. Dr. Salmon is one of our summer reading sponsors and sponsors one of our programs in the summer. We always have a big summer program. And I know with 5 kids, you said they like to read, that you know the importance of reading. And
oh, yeah. Lots of studies directly correlate reading with doing well in life.
Oh,
yes.
I
mean, getting into college and good grades, and I mean, it just it opens your world if you read. So we encourage our children to read.
Good.
And in fact, I get into all these. My oldest loves to read the current trendy trilogies that are out right now, and so I find myself reading them just so we can communicate about that. It gives us common ground to have conversations about. But yeah, I've been very happy to sponsor the summer reading. I think it's a great program y'all offer for the kids in the area, and I think anybody that comes to the library realizes pretty quickly what a special library we have here, and how good y'all do putting these things together for kids. And so it's a great thing, and if you come to my office, you'll see the pictures y'all provide, and they're up. I'm running out of space for them now, but
hey, that's okay. We can always do something there. We appreciate it. I do think we have a wonderful place, and it's because of folks like you who help us put on our programs in the summer. We have a lot of wonderful sponsors, and we appreciate you doing that. So I veered away from dentistry a little bit, but I wanted to get back. We talked a little bit about people are terrified of the dentist. A lot of people are terrified of the dentist, and it's hard to overcome that. Any suggestions there? What can you tell them?
I'll tell you, that is probably the biggest benefit to my practice and growing my practice over the years has been that I've tried to tailor myself toward the fearful dental patient and actually pursue that patient. Because what happens is they've had a bad experience typically as a child. That's what you hear the most. And what I'll do is I'll sedate them for their first main appointment, or 2 or 3. But typically by that 3rd appointment, they realize I'm not going to hurt them. Right. We're all the staff and me. We're nice. We're not going to be mean. And they tend to come back. I would say 8 out of 10 people by that 3rd or 4th appointment. And they don't want to do sedation anymore. We've turned them around into not a fearful dental patient. There's still those people that are going to be scared the rest of their life, and we handle them too. But that is a great source of pride and pleasure for me to see that patient turn around and not be scared of the dentist anymore. And those become my most loyal patients. If a job change happens or whatever, and they move. I see those people routinely come back from Florida, Georgia, whatever, and if they need a dental procedure, they get in that car, or I've even had a lady fly from Texas back here to come see me because they trust me now, and they don't want to start all over again with a new dentist. And I don't want to encourage them to do that, but that's the way they feel. Right. That's great. Yeah. So.
Well, and y'all are so nice, and things have changed in dentistry too. It's not as painful as maybe it used to be, or it's not at all. Really, it's not at all.
Well, and that goes back to the laser thing. I can do a lot of my fillings with no anesthesia. If it's not a really deep cavity, or if it's a tooth color filling especially, I can just laser that out of the tooth and replace it, and a lot of times I don't have to give a shot.
Oh, that's good to hear. I don't like shots myself. Yeah, I don't like that terrible numb feeling.
Yeah, you can walk out and you're not numb. Yeah.
But that's okay if you have to do that. That's quite all right. But that is great. So if anybody's afraid of the dentist, this is the place to go because y'all take great care of them. When is the best time to start seeing the dentist, like with children? When's the best time?
Yeah, we get asked that a lot. I would say most dentists would agree with me that really by the age of 3, you kind of, because by then, at that point, you could have a problem. But if parents are not giving their kids sodas and feeding them candy, and they brush their kids' teeth, they shouldn't have had time to really have dental issues until about 3 years old, hopefully. And so, and about 3 years old, we try to get them around that age to come with their parent, and while their parents getting their teeth cleaned. And maybe they're not going to be in the chair, but they're going to see mom or dad getting worked on and looked at and kind of get familiar with it, so they're not scared. And if we can build their confidence, and then from there forward, we kind of might set them in mom's lap and take a look at them, and not a real official appointment just yet. You know, and we kind of test the waters with kids that way and see what works best. Some kids I can do fillings on at 3.
Wow.
And some kids are scared until they're more like 6 or 7, and then you can start to work with them more. But I would say by about age 3, we should have definitely seen the kid. Yeah.
Right, seen them. And I know most people know checkups every 6 months and brush and floss and all that good stuff. Anything you want to add to that?
I along those lines, I would say this. I see people cancel and skip their cleaning appointment, not put as much emphasis on it. If they have an appointment with me and they need something done, they tend to show up for that, you know.
Right.
But people will put off their cleaning visits a lot. But really, that is the most important thing you can do for yourself. If someone starts to get a cavity and we notice it in that 6-month window, if they're coming twice a year, then we fix it while it's small. And a lot of times I can do that without anesthesia, especially on kids where they really get nervous about shots, right?
Oh, yes.
And so that helps me do my job more effectively. But if they skip that appointment and a whole year goes by and that cavity is allowed that much time to grow deeper and bigger into the tooth, we're probably going to have to numb that up and, you know, do something more aggressive. So the cleaning visits also prevent you from getting gum disease. Okay. And that is the hardest thing that we deal with. I can fix broken teeth, cavities, no problem. But if you get gum disease and it runs rampant, it kind of gets, you'll hear the older people say pyorrhea.
Right.
You know, they'll remember that their mother lost her teeth and got dentures from that, you know, kind of thing. You don't want gum disease out of control. That's hard for us to turn around and treat. And it's just simple. You don't get it. Right. And the way you don't get it is you come get your teeth cleaned.
That's true.
So it's kind of like changing the oil in your car. You don't wait till the engine blows up, you know.
Then it's too late,
yeah,
right?
So.
Yeah. Well, that's great. So any other advice for us? Just come for our cleanings and keep up with that. And I know brush and floss and don't eat too much candy and all the good stuff that my mother always told me.
I would say my biggest pet peeve with people in their oral health is drinking sodas. If I see someone and they come into my office for the first time and nearly every tooth has a cavity in it, 9 times out of 10 it's because they drink 7 Dr. Peppers a day or 5 Mountain Dews a day, or you know, the sodas are just really horrible for your body in general. But we see the signs of it, of course, in the mouth with the teeth, you know, with the cavities. So if I could offer that advice, I would say don't drink sodas.
Great. So we can come to you for just regular checkups, dental cleanings, implants, laser dentistry, all kinds of things. So if they have any questions, they can just call you.
That's right.
I'm sure anything's
right.
going on.
We do consultations for free. If someone wants to come and just kind of see what they need, we work that in.
Okay, great. Now you said you do some cosmetic, is that dentistry or cosmetic?
Well, I mean, in way of cosmetics, I do a lot of Botox injections, Juvederm, fillers for lips and stuff. The laser treats these lines around the face, even bags around the eyes and stuff. And all of that stuff I love because it's not permanent. You know, if you got issues that you want to treat cosmetically and you want to do it permanently, go see a plastic surgeon. But you kind of live with what you get. You know, it's one shot deal, it's permanent. Reversible things have been in vogue now for quite a while, and it's so easy to do. And the benefit of Botox is great for migraine headaches and TMJ issues. I treat a lot with it, and it's much better than otherwise people live on pills for their headaches, you know.
Well, I'm glad to hear about all the different services you offer, and thank you so much for joining us today,
Okay,
Dr.
great.
Salman. Thank you for joining us on Library Connection.